Are these mics okay the way they are? Do I need to be mic'd up, or how's the audio?
Yeah.
It's good, yeah.
Okay,
it's
good.
Yeah,
Good.
yeah, thank you.
Well, thanks for coming out today. Marissa and I were talking on the plane. It's been quite a year. Saturday would be the 1-year anniversary of our first incident. And of course, here in the Magic Valley, Director Jepson and I, we were traveling somewhere, and we were talking to the health district and to the county commissioners, and of course Blaine County was basically I don't know how to gracefully say this, the kickoff of the incident rates in Idaho. But I brought with me today, and of course Melanie will have all of this, I know that there's the incident rate we have here in Twin Falls. You get the gist of the downward trajectory, but it's been a very busy year. It's good that we're here at the health district, because believe me, the people in this health district, the people in the healthcare industry, the people that operate and manage long-term care facilities, it's just been a very, very challenging year. And of course, the tragedy of the lives that were lost, and the families that were impacted, and the loved ones who couldn't see their families. But for the most part, a lot of that is behind us if we continue to do the right things going forward. From the very beginning, Director Jepson and my coronavirus working group, and we've had one, I think the last time I was here, I brought our chart with us, which was the FARS curve, but all we could operate by, because this was a novel coronavirus, was the experience that exists all over the world of what happens when you have a pandemic. And in essence, there's that curve up, and we've had a few of these, but now the numbers, and particularly the hospitalization numbers are and here in this health district, the hospitalization numbers, this is for this that's Public Health District 6. There's 5. There's our hospitalization numbers right there, and that was our goal. Our goal was that we wanted kids back in school. We wanted to keep people safe. We wanted to do all we could to maintain and regather our economic trajectory, and we did all of those things. But you can't do that. You can't get kids in school. You can't have economic prosperity if people don't feel comfortable that A, there's going to be room for them at the hospital, and B, they're going to be safe. We've still got a ways to go. Have you got any sequencing back? Have you got any of the variants here in this district?
Not in this district that aware of, but statewide.
Well, and one of the things we did not have in Idaho, we were sending all our samples out, is we now at our state lab, we're doing the DNA sequencing so that we can identify these variants. I was on a call with Governor Brown just a couple days ago, and there's actually a new variant over there that we're watching. But when you total everything up and look back at our chart, our healthcare capacity is okay, but we've still got a couple areas of the state, East Idaho, Bonneville, Madison, Jefferson County are still, our incident rate is higher than we want. The metrics that the Supreme Court is using is we're going to have jury trials and the counties have an incident rate of less than 25. Everything in this health district is under an incident rate of rolling 7-day incident rate of less than 25, and I think most counties are single digits, which is incredible. So those are all good. We're on top of doing that, we've got I don't know, yesterday's Wall Street Journal had on the front page a graph of how states were impacted, and our economic numbers, our tax revenue in Idaho are the least impacted of all 50 states. And a lot of that is a combination of the good work that we've done in public health, but also kind of the entrepreneurial spirit of people in Idaho to figure out ways to adapt to the changes that took place. It was about 11 months ago when all anybody could talk about was a shortage of toilet paper. And it seems like a long time ago in the pictures of grocery stores. But we had a lot of challenges during this. But I'm very pleased with what collectively everybody in Idaho did. Particularly the people in public health, whether they be frontline nurses or the team that works in this building. It's just incredible. When this first started, our coronavirus working group said, we don't know whether immunity is 6 days, 6 weeks, 6 months, or 6 years. And we still don't know all the answers. We know that it's more than 6 days. We believe it's over 6 months, particularly if we get a vaccination. We've got a significant number of long haulers in this area that are out there, and some of the long haulers are long haulers and they don't know they're long haulers because they were asymptomatic to begin with. We're going to continue to watch that through our healthcare system, but all in all the uncertainty that existed 1 year ago today, we've got a lot more confidence in what we're doing going forward. And with that, I'll try to take some questions.
What are some things you can say to Idahoans to encourage them to continue to take the safety precautions? Because I feel like when people hear the numbers are going down, they're going to think, oh, we can go back to normal. So what can you say to Idahoans to continue to?
We will be rolling out some public information ads, and I talked to Governor Cox in Utah, and he was telling me the crux of his, and that's, if you want to go see a high school graduation, if you want to go to a wedding, if you want to have these big events, wear a face covering, get vaccinated. Those are, and we didn't have the vaccine option even just 4 months ago. But all those public health advisories and recommendations need to continue until we get to an adequate number to where we can get the viral load down. These viruses can't mutate if they're not spreading. And so it's going to be a combination of people getting vaccinated and a combination of people being cognizant about it. Until we get to that area, they have to continue with that. But you're right, there's going to be a hesitation to let your guard down.
And nobody knows when the end is in sight, or the end, what's going to mark the end of this. I mean, public health officials are still working through that stuff. But as we move on through the months, people are like, I just want this to end. I just want this to end. And we've been saying
Put
that.
Me in that camp.
We've been saying that for a year now, even. How do people? I guess what I'm trying to say is there a timeline, and what marks that, and what I guess places do we have to get to?
I can't remember who I heard this morning, and we hear this often from the experts on it. It's not a light switch; it's a dimmer, and it can go up and down. We've been very concerned about the variants. I was on a call with quite a few governors this week, and the governors of states where they've got a higher percent of the variants, we asked them about severity, hospitalizations, variants, in vaccinated population. That's all good, but the variant is still a real question mark out there. The first two vaccines, Moderna and Pfizer, for the most part, were tested where the variants weren't there. The new vaccine at J&J, the Johnson & Johnson vaccine, was some of their work was done in countries where there was the variant, so we know more about that. Every day, public health, our professionals, our scientific professionals, are learning more and more about it, but it really is a dimmer switch. As things get a little better, but people have to be cognizant of the risks that are out there. It's not going to be, we can open everything up and go back to normal, and in fact they won't. Even if there was no no health district, no city, we don't have any state restrictions. Even if you didn't have any of that, what's incredibly important for parents sending their kids back to schools, for teachers being in schools, for people to go out and participate in the economy, in venues where there's, a lot of possible spread, they have to have confidence. So as our numbers continue to go down, that confidence level will go up. But it's too early to say we're going to flip a switch. It's going to be more people getting vaccinated, people continuing to do the right thing. That's going to get us to where we're going to be. But I believe by the president said that anybody that wants a vaccine is going to be able to get one by May. The vaccine delivery that we're seeing doesn't indicate that. But what I learned this week is part of what he's basing his prediction off is the vaccine they're shipping out separately that this health district doesn't see. It either goes to the retail pharmacies, to the big pharmacies, to the clinics, and to some of these other areas. We don't have full transparency on that. And so with all of that, what I ask anytime I travel around the state is whatever we're vaccinating now, can we triple that? Can we double and triple the vaccine delivery? And I haven't had anybody say no. And we actually get more and more people signed up. But there's two things I gotta get. I gotta get people vaccinated, and I need for them to show up on time for their appointments. We've had a problem with people calling, 2 or 3 health providers, a couple of pharmacies, booking reservations, and then as soon as they get the call, they don't cancel their reservations there. Well, that just slows down the vaccine process for everybody else. Here in this valley, we've got a lot of major employers, frontline employers, and we'll work with them to basically go on site and vaccinate their workforce.
So what do you guys attribute the low numbers to, and then what can you guys keep doing to make sure that trend stays low?
Well, I think a lot of it is, the ads, and you've got a couple of people from here in the Magic Valley were part of it. I think awareness. People are aware that for a long time, people knew other young people that tested positive and didn't have major complications. Now there's more and more transparency that being 20, 30, 40 years old and getting COVID can have some really significant long-term ramifications. Awareness of that has, I think, increased people's interest in getting vaccine and also interest in being careful. So I think a lot of it's awareness. You all know there was no shortage of data that was less than true out there on what the ramifications of that was. But we got our kids in school for the most part. There's some of them that are still in and out a little bit. Everybody wants their kids in school. Everybody wants the economy to rebound. And particularly, people want to visit their grandparents, go to a long-term care facility, attend a high school graduation, attend a wedding, all of those things. There's a real desire to do that. And if people can make the connection between their ability to do what's precious to them in their life and either getting a vaccination or doing this, that helps.
And we're in stage 3 right now, and we're mostly open completely. Is there a step where we get to stage 4 soon?
Oh yeah.
And what do you see rolling out there?
Well, we've changed the criteria. Remember, we started 11 months ago. One of our critical issues was ICU and ventilator capacity. Now, because of the way the health professionals handle it, and we got all kinds of ICU and ventilator capacity, what's now is important is just capacity in hospitals and incident rates. And we're spending a lot of time watching for the variants. Is it increasing spread? Is there some of that? So hospital capacity, and I've got a graph here of the number of hospitals in Idaho, and this is all on coronavirus.idaho, but there's still, on these sheets, there's still quite a few hospitals that are still somewhat stressed, but they're okay. There's not a hospital in the state. I think every single hospital in this region, they're wide open. They've got capacity. We were very lucky. One of the most fortunate things we had, I remember early summer in our meetings with our health team, worrying about the seasonal flu. Right now, the end of February and the 1st of March is usually, historically, when we've had a lot of hospital capacity consumed by people with the flu. We had almost nobody believes how small the flu was this year, and that's good, but it also left capacity for if we needed them. So that's part of the metrics we're trying to decide about going from up to 4. But if people continue to do the right thing, we'll get to stage 4. And literally, there's not a business that can't be open today.
So a year from now, what do you kind of hope for Idaho, and what can people do to get there?
Well, a year from now, well, by September, the schools should be wide open. Let me talk about schools before I talk about the rest of a year from now. A year from now, I hope, and the legislature's debating it right now, I hope they take my recommendations and frankly do more to where we get these kids caught up. We're out of school March, April, and May of last year. That getting these kids caught up is probably my highest priority, is to keep people safe and get these kids caught back up. A year from now, I hope with all our efforts, we got our kids back up, we're back concentrating on academic advancement, on literacy. A year from now, I hope the economy is still, if we can just stay on the same trajectory we're on right now, I will be happy that we'll have literally full employment, or which some economists think we've almost got full employment now. And what's really important is that we have an increase in wage rate, which Idaho's been very blessed. Our personal income growth, granted we started from a lower level, but we have personal income growth, that there's nobody that wanted a vaccine that didn't get one, and the people that were hesitant on vaccines feel comfortable enough that they will go out and get vaccinated. But kids in schools, people being healthy, and economic prosperity.
And how can these students in a year from now kind of regain what they missed? Like, what are some things that can be done to kind of get that missed time?
Well, it's interesting. There are several things that the pandemic accelerated. And, these kids need to have that professional in the classroom to do some of the motivation, some of the diagnostic that it's hard to do online. But we have really advanced online delivery. And if we can take these kids, figure out what their problem is, give them a device and help them, but you can't do it without that connection with that highly qualified professional. We have a lot right here in this school district that we're in right now. If we can do that, we can get these kids caught back up. But remote work, remote delivery of health care, Idaho had the biggest increase in telehealth of any state in the union. We've got a lot of initiatives, whether it be for schools, whether it be for rural Idaho, to expand broadband. The accessibility of quality health care, because we have so few doctors per population in Idaho, we can make up for a lot of that with really making our telehealth more sophisticated. And that helps everything. That helps these real rural communities where, you're blessed here in Twin Falls because you've got a great hospital. But a lot of the rural part of this state, if we can deliver health care to them, part of it remotely through telehealth, that'll raise the standard of living in the state of Idaho.
So now, a year later, we have a vaccine. What is like an estimated time frame as to when we'll reach herd immunity?
Again, that kind of depends. It depends upon if the infection rate of the new variants is more, because, and there's some pretty good videos out there that basically show, if you go into we're far enough apart here, obviously, but that if some of these are transmitted more by aerosol, and they're more apt to it, we're going to have to continue to watch that. We put lots of systems in place to where we can watch that, but if the variants don't do some of the worst case scenarios that some of the public health people are suggesting they might, if our uptake rate goes up, one of the big determining about herd immunity is if people quit demanding the vaccine. And we've got to go out and beg and plead to get them vaccinated. That will shorten the amount, that will lengthen the amount of time before we get to herd immunity. And the other thing is the science is going to continue to evolve on people that either were fully infected, asymptomatic. How long does their immunity last? Some of those people are the vaccine hesitant because they said, oh, I had COVID, I don't need a shot. Well, almost all the public health people say, you better get a shot anyway. There's all kinds of evidence that the vaccine gives you much better immunity than particularly a mild case of COVID. So uptake of vaccine, variant changes, those are the things, and herd immunity, again, is not going to be a light switch, it's going to be a dimmer. How did you know?
And so I'm going to sidetrack a little bit here. The president is supposed to sign his COVID relief bill today. He may have already done it by the time we're talking. I don't really know. But I believe he is supposed to sign it today. I know you've come out to say some things that you disagree with on the bill. Can you explain your position there? And are there things in there that may be helpful?
Oh, absolutely. There's no question about it. I mean, the group of senators that met with the president right after he was elected and basically proposed a bill that was about half of what this bill was. That only 7 or 8% of the total of it goes to COVID related. The other 92, 3, 4% of it goes to non-COVID related. Some of those are good programs. Not all of them are bad programs. But some of the programs I really disagree with. The fact that we're bailing out private pensions. The fact that states like Idaho that have done the right thing, we've worked hard, we haven't overspent, we've had balanced budgets. We're going to get penalized, and the states that have done the wrong thing are going to get basically Idaho taxpayer money to bail them out. I just fundamentally believe that we shouldn't do that at any level of government, the city, the state, the federal government, that you elect people to represent you, whether at the state level or the local level or the federal level, that people that don't do the right thing, overspend, have pensions that are unfunded or way underfunded, they shouldn't be bailed out. Because what kind of a signal does it send to everybody else? It's just like what you do with your children. You don't reward, well, occasionally you should love your children. But you try not to reward bad behavior. You try and incentivize, the one thing everybody does is try and incentivize good behavior. And that's my biggest objection to this bill, is it rewards bad behavior and punishes good behavior. It's just a fundamental, whether it's in business, whether it's in your family, or whether it's in government.
So what are some of the challenges that the state faces when it comes to getting us back to normal?
Getting the vaccine out, well, it was supply of vaccine, it still is for a while, but pretty soon it's going to be vaccine hesitancy, that people are going to be hesitant. So we're going to, with a lot of public partners and private partners, and I was reluctant when the vaccine first came out, when it was first rolled out, to say, let's really go out and advertise for it, because we knew we were gonna have more demand than we had supply. But the second thing is I want people to see that their neighbors, their family members, their coworkers have been vaccinated. They feel more comfortable. You know, older people can go visit their grandkids now, the benefit of it, and that there weren't any negative consequences. We know that there's a certain percent of the population, particularly when they get their second vaccine, have a small, mild reaction. But it's true in almost every vaccine that's out there. But the risk reward is off the Richter scale. The reward to get vaccinated is vastly more than the risk of, you know, feeling a little crummy for part of the day afterwards. So every day that that goes by, I think it's gonna help us with vaccine hesitancy.
And I guess this is probably the last one for me. Going back to that federal bill, there's one kind of thing that I thought I might bring up to you, because I know you're interested in early childhood education and stuff like that, and kind of getting people along the way in that sense. I believe there's a part in the bill that is going to give money to parents that have children. Is that correct? Is that something that you could see, and you know, that'll run out in a year, I believe. Is that something you could see happening in Idaho?
Well, I proposed, I think we were one of the only states, our strong families, strong children, strong families, strong families, strong children. We were one of the first states to do that, because at that point in time, we had a lot of kids home. And so we made a grant proposal to people, mainly based on need, to do that. But now, you know, here in a week or two, almost every school will be in at least 3 or 4 days a week. What I don't want to do is detract from our constitutional obligation, which is public school, by having funding available. That, you know, and we can do it a little short term, but if you put it in long term, it's going to end up competing for precious resources we need for our public schools, and that's written into our state constitution. That's our moral obligation. Some parents it works better for, but if, you know, what about the couple where they both absolutely have to work? I'm not sure I want to take their tax money and give it to somebody else when we have to make public schools available for everybody. I haven't seen the final on those proposals, and we'll look at them very seriously. But you know, I am absolutely confident that our public school systems, with the right resources, with some of the other things we're doing, that's the place where we need to have our kids. People can, you know, we've got a high percent of the population that homeschools in Idaho right now, and there's nothing to prevent them from doing that. And there's other programs out there. Yeah, you know, they can sign up for online education. We make all those resources available. I'm not sure what these bills do over and above the programs we already have.
Okay, I just have one last question. The Latino population has been disproportionately affected throughout the pandemic, and now with the vaccine, there's some hesitancy to get the vaccine within the Latino population. What are you guys doing to reach out to them, and what do you think you guys can do better?
Well, of course, we started early in the vaccine, the Hispanic Commission. One of the best ways to read that is through the Latinx radios, and we've been doing a lot of ads there, and then we've been doing a lot of outreach. And of course, they were a lot of them, particularly in this valley, were essential frontline workers in the food industry. And so right now we're going into those, and there was a smaller percent of the population that could work from home. We recognize all that. The clinics that work in these areas, they're literally, I don't think there's any limitation on the amount of vaccine they can get. If it's not this week, it'll be next week. If they can get people signed up, they'll be able to get vaccinated. And of course, we've got a higher percent of that population that lives in multi-generational homes, so they're more susceptible. Obviously, the older population there, if they sign up, we'll deliver vaccine to them. But we're going to do more to get remote delivery of But we recognize that issue and we're doing all we can. I know in the valley here that the Catholic churches are serving as a venue for vaccine delivery, and that's a place where people are used to, they're comfortable, and we're, any good options out there we'll explore. All right, thank you very much.
Thank you.
Thank you.